Gentlemen, I want you to imagine a situation that many men experience, but almost no one talks about openly. You reach intimacy, you feel the familiar buildup, the pleasure is present, the climax sensation clearly happens, but afterward something feels different. There is little fluid, or none at all. For a moment, your mind freezes. You immediately wonder if something serious has gone wrong inside your body. Some men notice it once and become anxious the entire week. Others see it happen repeatedly and carry the worry silently for months. They hesitate to mention it to their partner. They search the internet late at night and often find frightening explanations. The most common fear I hear is simple: does this mean I am losing my masculinity? I want to reassure you right now. What you are experiencing is not a judgment on your manhood, and it is not automatically a dangerous condition. It is a message. The body is signaling that one part of a complex system has changed, and when we understand the mechanism, fear becomes clarity. I am Dr. Narita, and for many years I have worked closely with men in midlife and later life who face exactly this situation. Almost every one of them arrives worried and embarrassed. Almost every one of them leaves relieved after understanding what is actually happening. Before we talk about causes, you need to understand an important concept. Most men grow up believing climax and ejaculation are the same event. They feel like one single action, but biologically they are two separate processes that usually occur together. Climax is a neurological event. Your brain and spinal cord generate the pleasurable sensation. Nerves fire in a coordinated pattern and your body experiences that intense peak of release. Ejaculation is a mechanical event. It involves muscles, glands, and ducts physically moving fluid out of the body. For most of your life, these two occur at the same time, so you never think about them separately. But it is entirely possible to have the sensation without the outward fluid. When that happens, we call it dry ejaculation. Many men describe it in my office as an Humpty climax. The pleasure exists, but the expected physical sign is missing. Because men often associate the fluid with fertility and virility, its absence can feel alarming. However, the nerves responsible for pleasure may still be working perfectly. The change usually lies in the delivery system. To understand this clearly, picture the reproductive system like a coordinated team. The testicles create sperm cells. The seminal vesicles add nourishing fluid that makes up most of the volume. The prostate contributes protective secretions that help sperm survive. All of this material gathers inside a channel called the urethra. At the moment of climax, specific pelvic muscles contract rhythmically. These contractions push the fluid outward. Timing is extremely precise. Nerves send signals, muscles contract, and a small internal valve closes the bladder so the fluid goes forward instead of backward. If any part of this sequence is altered, the sensation can still occur while the fluid does not appear. The system is working partially, not completely. Now let us discuss the most common reason this happens. Inside the bladder neck, there is a circular muscle that acts like a gate. During climax, it should tighten firmly. Its job is to block the entrance to the bladder and force fluid outward. Sometimes this gate does not close strongly enough. Instead of traveling outward, the fluid moves backward into the bladder. The pleasure still occurs because the nerves function normally, but you see little or no external fluid. Afterward, the semen mixes with urine and leaves the body later when you urinate. Many men become frightened when they notice cloudy urine afterward, but medically this is usually harmless. The body simply redirected the fluid to the wrong exit. Why would that gate weaken? The most frequent reason is previous prostate or bladder treatment. Surgeries that successfully relieve urinary blockage can affect tiny nerves controlling that valve. Another reason is certain medications, especially those used for prostate enlargement or blood pressure. These medications relax smooth muscles to help urination, but they may also relax the bladder gate. I remember a patient in his 60s who believed he had permanently lost his sexual function after a prostate procedure. He was convinced intimacy was over for him. After a simple explanation and evaluation, he learned that his pleasure sensation was normal and only the direction of the fluid had changed. The emotional relief he felt was immediate. The second major possibility involves obstruction. Imagine a pipe that carries water. If something blocks the pipe, the water supply exists but cannot pass through. The reproductive ducts can behave similarly. The glands may produce fluid normally, but a blockage prevents it from exiting. Blockages may develop from inflammation, previous infections, or scar tissue formed long ago and forgotten. Some men notice a gradual reduction in volume over years before it becomes nearly absent. Occasionally, mild pelvic discomfort appears during climax because pressure builds behind the blockage. The encouraging news is that many of these cases are treatable. Reducing inflammation or clearing the passage can restore normal flow. Modern urology has minimally invasive ways to evaluate and correct these issues. A third factor involves hormones, particularly testosterone. Testosterone supports the function of the prostate and seminal vesicles. When levels drop significantly, fluid production decreases. The first sign may be reduced volume, followed later by reduced desire, weaker erections, fatigue, and decreased motivation. Men often assume this is simply aging, but sometimes it is a measurable deficiency. A straightforward blood test can clarify it. When medically appropriate treatment can improve not only sexual function, but also mood and energy. At this point, you should understand something reassuring. In most cases, dry ejaculation is not dangerous. It is a functional change with a specific explanation. However, there are situations where you should not ignore it. If the change occurs suddenly with pain, fever, blood in urine, burning urination, or numbness in the genital area, evaluation should not be delayed. Certain neurological conditions, uncontrolled diabetes, or rare urological problems can affect nerve signals and require professional care. The emotional side is equally important. Many men feel embarrassed and begin avoiding intimacy. They fear disappointing their partner or being judged. But intimacy is not measured by fluid volume. Connection, affection, and pleasure involve far more than that single physical sign. Understanding what is happening removes a large portion of anxiety. When men learn the biological explanation, their confidence often returns even before treatment begins. In the next part, we will talk about what steps you should actually take, what tests doctors use to diagnose the cause, and how most men successfully restore confidence and comfort once they address the underlying issue. Now let us move from understanding to action, because knowledge only helps when you know what to do next. The first and most helpful step is very simple. Do not panic and do not ignore it. Many men choose one extreme or the other. Either they assume the worst immediately and become anxious, or they pretend nothing has changed and avoid medical evaluation for years. Both reactions increase stress. Instead, approach it the same way you would approach any change in your health, calmly and methodically. When you visit a urologist, the evaluation is usually straightforward. The conversation itself is often the most important part. I will ask when you first noticed the change, whether it appeared suddenly or gradually, and whether you have any other symptoms such as urinary difficulty, discomfort, or changes in erections. Your medications also matter. Many commonly prescribed drugs, especially for prostate enlargement, blood pressure, or mood conditions, can influence the small muscles and nerves involved in ejaculation. After the history, a basic physical examination follows. This is not meant to embarrass you. It helps assess prostate size, nerve sensitivity, and circulation. Often a simple urine test is performed after climax. This test can reveal whether seminal fluid has traveled backward into the bladder. Finding sperm in the urine strongly suggests retrograde ejaculation and immediately answers the mystery. Blood testing may also be recommended. These tests evaluate testosterone, blood sugar, and sometimes thyroid function. Why? Because the reproductive system does not operate alone. Diabetes can damage tiny nerves over time, weakening the bladder neck valve. Hormonal imbalance can reduce glandular activity. Identifying these factors allows targeted treatment rather than guessing. Let me explain treatment in a realistic way. The solution depends entirely on the cause. If medication side effects are responsible, sometimes adjusting the prescription or dosage solves the problem. Never stop a medication on your own, but your physician can often choose an alternative that protects both urinary health and sexual function. If retrograde ejaculation is the issue and fertility is not a concern, treatment may not even be necessary medically. The condition itself is usually harmless. However, if fertility matters, specific medications can strengthen the bladder neck muscle and redirect the fluid forward again. If obstruction exists, anti-inflammatory therapy or minimally invasive procedures may reopen the ducts. These modern treatments are typically brief and far less complicated than people imagine. Many men resume normal function after recovery. If low testosterone is identified, carefully supervised hormone therapy may be considered. I emphasize carefully supervised because proper monitoring ensures safety. When appropriate, men often notice improvements not only in fluid production but also in mood stability, mental clarity, and physical strength. There are also supportive lifestyle changes that improve outcomes regardless of cause. Good blood circulation supports every step of the sexual response. Regular walking, light resistance exercise, and maintaining a healthy weight improve vascular health. Stable blood sugar protects the delicate nerves that control the process. Adequate sleep restores hormone rhythms. These actions may sound simple, but biologically they are powerful. Communication is equally important. Silence creates tension. Many partners misinterpret withdrawal as rejection when the man is actually feeling worried or embarrassed. A simple, honest conversation often relieves both sides. Most partners are far more understanding than men expect. When anxiety decreases, performance pressure decreases as well. I want you to remember a very important truth. The presence of fluid has never been the true measure of sexual satisfaction. Pleasure comes from nerve sensation, emotional connection, and comfort with your partner. Many men continue to experience full pleasure and intimacy even when the fluid volume changes permanently. What harms confidence is not the condition itself but uncertainty. Once you know the cause, the mind relaxes. When the mind relaxes, the body functions better. Anxiety alone can interfere with erections more than physical factors ever could. There are, however, a few warning signs you should always respect. Seek prompt medical attention if you notice severe pelvic pain, burning urination, fever, visible blood, or sudden numbness in the genital region. These symptoms suggest inflammation or nerve problems that require timely care. Early evaluation prevents complications and provides reassurance. Let me also address fertility for those concerned. Dry ejaculation does not automatically mean infertility. In retrograde cases, sperm often still exist but travel into the bladder. Specialized fertility techniques can retrieve and use them successfully when needed. So even in this scenario, options remain available. Emotionally, many men feel a quiet grief after this change, as if they lost a part of their identity. I understand that feeling. But masculinity is not defined by a single physical response. It is defined by vitality, responsibility, emotional strength, and presence in relationships. A medical condition cannot remove those qualities. I have seen men arrive worried and withdrawn, convinced their intimate life was over. After evaluation and explanation, they regain confidence. Some receive treatment, others simply gain understanding. In both cases, the fear disappears, they reconnect with their partners and with themselves, so your action plan is clear and manageable. Notice the change, schedule an evaluation, review medications and health conditions, and follow medical guidance calmly. Maintain healthy circulation through movement and rest. Speak openly with your partner, and most importantly, release shame. This is a medical topic, not a personal failure. You deserve clarity and peace of mind. The body is communicating, not condemning. When you respond with knowledge instead of fear, you regain control. Thank you for spending this time learning about your health. If this discussion helped you feel reassured or informed, share it with someone who might be quietly worried about the same issue. Many men suffer in silence simply because they believe they are alone. Take care of your health, stay attentive to your body, and remember that changes are often manageable once understood. I'm Dr. Narita, and I look forward to speaking with you again.